Okay, we're going to talk a little bit about rotator cuff tears today. One of the big concerns is, do I have one or don't I have a rotator cuff tear? One of the things you got to understand about rotator cuff tears, depending on the size of it and the size, whether it be a partial tear or full thickness, you may need to seek a surgical consult pretty quickly, because if you have a full thickness rotator cuff tear, a lot of times if you allow too much time to transpire, you can't repair it. You'd actually, just vision, you've got this tendon right here, and there's a separation and a full tear. And then over time, if you don't actually surgically repair it, it actually slowly gets they have atrophy at it, and it slowly retracts. And actually in the muscle belly, it gets kind of fatty, and the surgeons, it's very hard to pull that across and make a good repair. So it's good to know if you actually have a full rotator cuff tear, so you don't have a problem with this. One of the times in orthopedics, waiting around and just hoping it feels better is not a great idea. So we're going to go over a couple things as far as how we test it and how you can self-test a rotator cuff problem. Frank is going to be our model here. He's going to be great, just back fresh from Hawaii, so he's very relaxed and all that, so hopefully I don't irritate his shoulder as we evaluate him. But what we're going to do is we're going to give a few tests. Let's talk about the rotator cuff a little bit first before we go into whether it has a tear or not. So basically it's a series of 4 muscles. And Kathy, actually, can you get Bucky for me in a minute? We're just going to get our skeleton here. We're going to do a series of 4 muscles, essentially, that are right about, the top one is called the supraspinatus. It runs right about here on Franklin. Right, it's not the, you got the collarbone here, and right on the top here, right at the top of the shoulder blade, okay? Then you have the infraspinatus and teres minor. Let's have you turn around.
It's harder to try.
Turn all the way around here. That are down below, they're called the spina scapula, in this area and here. And then there's one deep, that's actually in the front. That's good, you can leave it there and I'll drag the rest with me. In fact, we have this, why did I drag Bucky? I don't know. So on the inside right here, this is like Franklin's right shoulder, the parts we were talking about were the supraspinatus, which are in the top here. There's 2 other muscles that come in here that attach to the humerus, that bone, your shoulder bone, right here. And then there's one that's actually deep to your chest on the inside here. They're called the subscapularis, which you almost never hear about. And it's not commonly torn. One of the 4 muscles that's most commonly torn is the supraspinatus. And that's the one here, and as it attaches real close here. Okay? So one of the things you'll notice when you have rotator cuff tear, you'll have night pain. It really hurts a lot when you're lying down on that side. Reaching back for your waistline or your belt and all that, that's a movement that's very painful. It typically gives you pain in the front. You'll complain of pain in this general area. Typically pain doesn't refer past your elbow. If it goes past your elbow, it can be a very severe rotator cuff tear, or it could be a neck problem, or what I call cervical problem, that's giving you pain in the same area. And that can be confusing, even for surgeons. Unfortunately, there's a few people I know that have had rotator cuff repairs, not a lot, that actually had a neck problem. And that was really the main pain area. So it's good to kind of know what the difference is between the 2. So those are some of the things just to consider. Those are commonly the complaints you'll notice. The other thing too is when you see someone with a rotator cuff tear, especially a really large one, more of like a plus 50 population, when they try and lift their arm, they'll kind of shrug and they'll extend their back, trying to lift their arm up, especially to the side is the most limited direction. So if you have one and you're in the driver's seat, reaching to the passenger side is a really tough movement for you to do. So those are some of the things you'll notice. Night pain is really one of the key things, but a lot of weakness, and that's one of the differences. So if you're kind of doing this when you're moving, and then you take your hand. It's a good self-assessment. So if you try and do this and you can't quite move it up, but yet you can still move it full range with your opposite hand, that tells you something about it. The other thing, which is a great self-assessment, is you can take your hand, raise it up, and just try and see if you can lower it. And if it kind of drops away, especially if it's painful, that's most likely a good-sized rotator cuff tear, all right? Especially if you lift it to the side, just a little awkward lifting your arm to the side. But you lift it up and just try and really control it down. If they can control it, but it's just really painful, that's a classic sign. And a test that we use, often called a drop arm test. We'll move the patient's arm up, and we'll see if they can lower it down, all right? So another sign, there's a few other tests we do here. The other one is called an empty can test. So I'm going to ask Franklin to sit up nice and tall. You always want good posture for. All right, we're going to take both our arms. We're going to take our thumbs down, like you're emptying a can. Go figure, that's what the name is. And you're going to try and apply equal pressure to both sides, downward pressure. And there should be a significant difference left to right. Like this one will just give with me. We'll just give. The other one is going to stay reasonably strong. It can be painful. You can also have a tendonitis that can give you some of the same things here. When it's something very painful, you'll have that giving way. With experience, you'll kind of notice a difference, but at least it tells you there's something there. Okay, you can have a tendonitis and be very painful for very strong. All right. Another thing too is called a crossover test. I'll tell you a little bit of effect with the shoulder. So you're gonna cross over like this, and they'll complain of pain just right around this region right here. Very painful, and they'll call it a crossover test. So that's one of the other ways you can check for rotator cuff tear. So another way that we test it, we formally test the strength of it, is you bring your arms just like this, hold your arm there, and I'm going to try and push in this direction. This is for one of the lower muscles. So the other ones were for the supraspinatus. These are for the lower muscles called the infraspinatus and teres minor. They contribute to this motion, almost like when you're driving. It's like that motion. People say when they're driving, I can't do this. So I'm going to say, hey, just resist me. Apply pressure like that. And when people have problems, they literally just drop it. They can't move at all. So those are some things with rotator cuff. If we're unsure about it, I mean, you can also have other painful conditions that you do the same motion with, called a frozen shoulder, when the shoulder gets very tight and stiff, and you got to work on some range of motion with that. Either one, not all rotator cuff tears actually have to be repaired. The full thickness tears are the ones you really want to really repair and seek help and get a good orthopedic evaluation. They may do an x-ray to start off, and oftentimes the early diagnosis they have to use an MRI, and that'll identify the soft tissues and tell you a little bit about it. So that's pretty much everything on rotator cuff tears. If you have any questions, you can always call the clinic. We can take a look at it and tell you whether you should kind of get to the doctor quickly or you can wait a little while. But this is a very important area to look at and not wait. A lot of things we can wait on. This one you don't want to wait on. Okay? Thanks very much.